got unique to
Wonderful. So we're going to kick off our webinar today, and we're really excited to welcome everyone to the webinar on protecting and elevating early years programming during and after COVID-19. We're excited to share some tools and resources for all of us across organizations, including Brookings and the World Bank and Unicef. Before we do that, just some quick housekeeping notes. If you can introduce yourself in the chat, make sure you select all panelists and attendees. And then if you have any questions as the presenters are presenting, if you can share that in the Q&A box. And so to help us get started and set the stage, I'll introduce my colleague, Melissa Kelly, who is the coordinator for the Engaging Policymakers in Early Childhood program at the World Bank. Over to you, Melissa.
Thank you so much, Shakofe, and thank you all for joining us today. We're really excited to have this panel and to engage you in discussion. So we will be focusing on protecting and elevating early years programming during and after COVID-19 and presenting tools to support adequate, equitable, and efficient investments. Next slide, please. Thank you. So my name is Melissa Kelly, as Shakofe said, and I'm on the early childhood team at the World Bank. And today you will be hearing from Ana Nieto and Jennifer Asman. First, Ana is the early childhood development specialist at Unicef headquarters, and Jenny is a policy finance specialist in the social policy department at Unicef headquarters. You'll also be hearing from Divya Lata, who is the educational specialist focusing on early childhood education, or ECE, at the education section of Unicef headquarters. Emily Gustafson-Wright, I'm sorry, I can't see everything, at the Brookings Institution, and Sarah Osborne, also at the Brookings Institution. And then we'll be hearing from ECDEN on the cost of investment, and we'll be hearing from Claudia Vasquez and Elizabeth Lule. So quickly, I'll take you through the agenda so you can see how we will go through today, both sharing the tools with you as well as the opportunity to hear from you in our Q&A. So quickly, I'll just share a few remarks on the importance of investing in ECD financing at this time, and then we'll pass it over to Ana and Jenny to share more on a global resource guide and brief on ECD financing during COVID-19. We'll then go to Divya Lata from Unicef, who will share more about the ECE Accelerator costing and simulation tools 2.3 and 3.3. And I think many of you are already familiar with these tools from the launch and the efforts with the ECD community. Then we'll be hearing from Emily Gustafson-Wright and Sarah Osborne from the Brookings Institution, and they'll be sharing more about the standardized ECD costing tool. And lastly, we'll be hearing from Claudia Vasquez, working with ECDEN on assessing the cost of inaction. So after giving an overview of all of the tools, their uses, and how you can get engaged, we'll have a panel discussion to find out more about the linkages across these tools, and then we'll have time to hear from you with any questions you have for any of the presenters. So before we turn it over to Ana and Jenny, I just wanted to share a few remarks about the importance of ECD financing in this current moment. So we know that investing in young children is one of the best things that countries can do to build human capital. Children's growth and development in the early years forms the foundation for future learning, productivity, and lifetime success. And each of these tools that you see that will be presented today in this session are useful in different ways for helping policymakers and practitioners to plan, monitor, implement, and advocate for greater investment in quality early childhood programs, including health, nutrition, education, child protection, and social protection. And you'll see throughout the presentation that you might see ECD or ECE with more of the focus on educational programs for 0 to 6. These tools are even more relevant in the aftermath of COVID-19 and the current context of COVID-19 in two ways. The pandemic has placed increased burden on parents and caregivers as frontline responders in the crisis of care and learning. And second, the economic crisis caused by the pandemic means that governments are facing increasing fiscal space limitations, which may lead to budget cuts and reprioritization of services now and in the future. So it's more important than ever to engage in collective action on clear and evidence-based messaging and support to countries to protect and enhance ECD investments now and during the recovery period. In addition to showcasing which piece of the puzzle each tool addresses and how it works, the presenters will also highlight linkages between these tools and how they can be used to protect and promote ECD financing as countries grapple with the fiscal crisis brought on by the pandemic. So Shakose, I'll turn it over to you to get started. Thank you.
Thank you so much, Melissa. And now over to Ana Nieto and Jennifer Asman from Unicef.
Thank you so much, Melissa and Shikufe, for that great introduction. And it is a pleasure to be here today to talk a bit more about the work that Unicef has been doing in recent years to move the agenda forward in terms of public financing for ECD. Next one, please. So we wanted to start by very briefly sharing with you why we think it's so important to strengthen public financing for ECD and ECE. I think we all know here that one of the key successes of our global advocacy in the last couple of decades is that ECD and ECE are now a cornerstone for national development plans in many countries, and it is recognized as one of the key elements for the SDG agenda. We also know that over 80 countries now have comprehensive and integrated ECD policies, and that many of them actually have clear interventions within sectoral plans in this area. However, it's not all good news. We also know that often policies don't translate into budget commitments, and more importantly, that many times those budget commitments don't translate into equitable and efficient spending. We know, as Melissa was saying, that now the gains that we have acquired in the last couple of decades are at risk due to the disruption of services, a crisis of care and learning where parents are first-line responders of their children's needs, and an environment of financial constraints that are affecting all economies. Therefore, we know that it is important to work together to protect and enhance ECD and ECE investments and tackle the financial bottlenecks. In Unicef, we have been trying to contribute to this agenda in 3 ways. The first one is capacity building of our own staff and also of our partners. And to do that, we recently launched a global guide on public financing for ECD that I will briefly describe today. The second stream of work is advocacy, continue to push for the visibility of the consequences of the economic and fiscal policies in children's and families' lives, and working together to make an investment case for protecting social spending during the COVID crisis, but also during the recovery period. And finally, leveraging resources to support national fiscal responses. And this includes ODA, debt relief, and many others. Next, please. So talking about the Global Resource Guide on Public Financing for ECD, I just wanted to highlight key parts of that guide that I really want to invite you to read if you have time, and my colleague Jenny in the final slide will share with you the link. So the first thing is to say that the guide acknowledges that it is hard to talk about public financing of ECD because ECD is multi-sectoral. So we all grapple with, where do we start? What interventions do you want to cost? What is the investment case you want to make? So the guide walks the reader through the key steps in trying to organize that ECD product. What are the key interventions that in a given context we want to advocate for, we want to see more investment going towards? The second point that the guide makes is that before we jump into saying we are going to do a cost of inaction or a public expenditure review or any other sophisticated analysis, we have to take a step backwards and actually see how can we first understand the political economy in a given country. Who are the key players in the budget process? How does that budget process work? What is the budget cycle in that country? Is it centralized? Is it decentralized? Only once we really understand that political economy and the fiscal space around ECD, we can really go forward and select a specific tool. And the other key message from the guide is that in order to be effective in our work in this area, it's helpful to think about different typology of services. One is the sector-specific services. So here is a great example is pre-primary education. It is an intervention that is usually within the scope of the sectoral plans and budget, but we always know that it is underfunded. And the other category is the add-on services. And this builds on the concepts that the Lancet in 2016 and the Nurturing Care Framework really brought forward. And is the idea that the only way that we are going to go to scale on ECD is by adding into existing services. What is the health services? What are the key health services in a given country? The nutrition platform. How can we make the immunization visits, the well child visits, the antenatal care visits more responsive, more nurturing? How do we just add to those so we can have those responsive care and early learning components embedded into those services? Next, please. The guide also proposes 3 core actions to address ECD financial bottlenecks. The first one is how can we get better at budget advocacy? And a key message from the guide here is we ECD practitioners need to start talking the language of finance. We need to have the right evidence and language for the right financial decision makers. So next time that we go and approach the ministers of finance or the ministers of planning, we actually understand where they are coming from. And they are coming from a hard logic that is centered around 2 things: affordability and the idea of what is the budget cycle in that country and what are the financial constraints. So how can we create evidence that actually starts by addressing those assumptions that they have? The second action that is proposed in the guide is how can we go beyond just advocating to also working hand in hand with the line ministers in each country at the national level and subnational level, depending on the case. But here the important thing is how can we make those budget submissions that are going to go to the ministers of finance stronger and more comprehensive. And at the same time, how can we work with countries to make sure that the transfers that are going from the central level to the decentralized level actually have an equitable lens? And the final one is promoting budget coordination. And here we really know that this is easier said than done, and not all countries are going to be ready to start at that level. But in those countries where there is potential to build on existing coordination mechanisms, how can we get better at identifying gaps, avoiding overlaps, knowing that this is going to be a key strategy if we are actually want to have efficiency gains? Next one, please. The last chapter of the guide provides a toolkit for evidence-based advocacy that portrays 6 key tools, including cost-benefit analysis, budget analysis, public expenditure review, and many others. And what I really like about this chapter is that it tries to make it very easy for the reader to quickly understand what is this tool about, how can I use it, when should I use it, but then move forward with examples, case studies from various different countries and regions that explains how offices across the world have actually used these different tools and what they have learned about it. Next one, please. A good example of that, of those case studies is the case of Montenegro, where we worked together with the government to carry out a cost-effective analysis of the different policy options that the government had to increase enrollment in preschool services in the northern regions of the country, where actually enrollment was really low. And what we saw there is the successful combination of three things. We had the sophisticated study, but then we coupled that with a very wide advocacy strategy that included parliament, government, and the general public. And we also tested some of those different delivery modalities that were proposed in the study. The results that we had were very positive. Number one, we were able to actually use the recommendations from the study to influence the national strategy for early childhood and preschool education. And we saw the Treasury actually committing funds to hire more teachers and formalize the pilot sites. And all that resulted in increased enrollment rates, including the most marginalized areas. So with this, I'm going to hand it over to my colleague, Jenny Asman, who is going to explain how we have been working in Unicef to turn all this work into something that is adaptable and responsive to the COVID crisis. Over to you, Jenny.
Thank you, Anna. So, as Anna has described, a key focus of the resource guide is to provide support into how to analyze and engage in public finance issues and bottlenecks in different contexts. And of course, following the COVID pandemic and the impact that it's had, there's been a change in context across the globe. And although the specific challenges and opportunities vary across countries, a common feature, as Melissa said, is a constrained fiscal environment as government revenues drop and governments respond to greater demands, obviously across the health sector, but across all social sectors and to support the economy. So reflecting on that context and what it means for the way that we engage in financing for ECD, while we still have the goal of greater and better investment, the reality that we face is that we are now looking at protecting existing ECD investment and finding ways to maximize the impact of scarce resources, given that in many contexts it may not be possible to increase spending. So as Anna said, the way that the guide has been set up is it's very much focused on the key decision makers and using evidence-based advocacy to increase resources for ECD, and that means engaging in the budget. So although the context has changed, the entry points are still the same, but the budget may look a little different. As Melissa said, governments may be seeking savings and cuts. The opportunities in the budget may be different, and there may be different opportunities depending on sector. So governments may be introducing COVID recovery or response packages that include funds for health and social protection that may be relevant for ECD. And likewise, government support for education may be changing ways that introduce new challenges for ECD. Another part of the context that has changed is that the budget process has frequently become more rapid and provided less opportunity perhaps for consultation or discussion, and adjustments when they are made come quickly. So the opportunity to engage in this process may be shorter, and it's really a question of being prepared for how to engage in that budget process. And then again, of course, in many contexts, we are looking at emergency situations, emergency changes, and the introduction of recovery messages, either as supplements to the budget or changes in the budget. So when we look at the current context and we look at the approach that UNICEF is working with in countries around the globe, it's the same tool, but the targeted advocacy and the messages need to be adapted to face this new reality. Next slide, please. So same tools, but different targeting. So looking at how these tools can be applied in the COVID context. I mean, obviously the budget is still a central focus for engagement, but the type of engagement in the budget may change. Budget analysis remains a really critical tool to understand what is happening to ECD spending in the COVID context. So to identify if funds are under risk, if funds have been cut, if key sectors that link to essential ECD activities are moving or shifting, and in particular in recognizing the pressures on government and the scarce resources that they have in this situation, looking for ways within the budget to come up with new efficiency improvements to get the maximum impact from scarce resources. So as part of this, tools like cost effectiveness analysis are even more important. So looking at across the different ECD interventions to work out which can have the greatest impact, and using this to help prioritize. If you're working within a certain amount of resources, where should those resources go to have the greatest impact on ECD? For costing, which Emily and Sarah will talk about more later in this presentation, I wanted to mention this just quickly here because it's a really critical tool that helps us to be clear and concrete in our policy asks. If we're seeking resources in the budget, obviously it helps to be able to say how much resources are required, but it can be just as useful as a policy tool to use costing to defend program funding by showing what can be achieved with different levels of funding, and ideally by defining essential priority funding and the minimum spending to achieve certain goals, using this to protect funding in the budget process. And equally, having a pre-prepared costing is really helpful if there is a rapid discussion or debate around a COVID stimulus or recovery measure to be able to successfully advocate to include specific ECD activities. And finally, investment cases, which is making that an evidence-based argument for priority ECD investments, both socially and as an economic investment and based on the rights of children. Next slide, please. So some examples of engagement in this space, and some of the lessons that we've learned from this in the last year and a half of operating in the COVID context. I wanted to use the example of Croatia, where Unicef was working closely with the government to cost different scenarios for universal access to kindergarten before COVID hit. This was an example of using the same tools, using the same type of analysis, but rapidly pivoting to the different context. So after COVID hit, the data and model and costing work was then used to advocate for the inclusion of this priority activity in the COVID response funds. And this was a very time-limited opportunity, but was successful. So an additional 500 million US was secured to expand kindergarten access as part of the EU Recovery and Resilience Facility. So this was a 20% increase in the pre-COVID annual budget, and shows that it is possible to continue to strengthen ECD investment even under difficult contexts by ensuring that ECD is considered when we're looking both at COVID response and COVID recovery as we move forward in the pandemic. Next slide, please.
Annie, I just want to nudge you. We're about 4 minutes over time, so if we can wrap up.
Yes. So just very quickly, this is an example of a cash transfer program, which is obviously very important as a COVID response, but incorporates essential elements for ECD. So tools that encourage co-parenting alongside a cash payment. Next slide, please. I wanted to make the point that when we're looking at evidence-based advocacy, it is something that needs to be done both in country, and because we're looking at a global situation, a global crisis, to elevate that advocacy to a global level. So the three activities are relevant at both country and global level, and that's focusing on safeguarding critical ECD spending, ensuring financial resources are used efficiently and effectively, and mobilizing and deploying additional finances from all sources. So I've spoken about kind of the country focus and engagement with government, but we also need to look at how we can lift those messages up to a global level and advocate for investment in ECD as part of the inclusive recovery. And that includes global mechanisms like debt relief, ODA, fiscal space for investment. Next slide, please. This is my last slide, and we'll share this resource afterwards. But this was an example of how messages at both global, regional, and country level interrelate. So this was an analysis looking at actual spending on children 0 to 6 in health and education in the East and Southern Africa region. And as you can see, it really highlighted that spending in the early years is lower than spending in later years for children. And this therefore means that governments are missing the demographic dividend and the social and economic benefits that we know come from investing in the early years. So this regional analysis has already been compelling for countries in the region, and it's now being followed up with tailored discussions in countries, looking at exactly what is happening at a country by country level, and then using that to start to have discussions about how to look at opportunities to invest in the early years going forward as countries start to look at prioritizing their spending. Last slide. And the last slide is really just a plea to stay in touch. Obviously, this is an area of significant priority and activity. A lot is happening. We captured as much as possible of Unicef's engagement in this space in the resource guide, but it's continuing to grow and adapt both to the changing context and as countries move further and try new approaches and tools. So please keep in touch with us in your work in this space, and we will continue to reach out and try and take these resources and support further. Thank you.
Thank you. That's great. And now I'll turn it over to Divya Latta, education specialist at Unicef. And just a friendly reminder to panelists, when I come on video, it means you have about 2 minutes left. And I also encourage panelists to be responding to the Q&As as they're coming up, and to attendees to be submitting your questions in the Q&A. Over to you, Divya.
Thank you very much, Shikufe, and warm greetings to all colleagues on the call. This is a deep dive into the education sector after the overview for ECD across the board, across all sectors. So here, next slide, please. So what I'm going to try to do is to share with you some tools which are specific to the education sector and pre-primary education, or early childhood education as we call it. And we see that cost and financing is really one of the 3 key strategies on the roadmap to achieving universal quality pre-primary education by 2030 as a global commitment towards encapsulated in the SDGs also illustrates. Let's go to the next slide. So I'm going to just try and very quickly in the next 10 minutes or so try and wrap this up. So, but first of all, to share with you the one of the key solutions in really strengthening the ECE subsector is to mainstream ECE within education sector plans. And indeed, if we need to get the budgetary support, the policy support, and also looking at the accountability systems that need to be embedded within the subsector, then linking it to the education sector analysis and the strategic planning that goes on needs to be central to the solution. The ECE Accelerator is a toolkit which has been pulled together from resources of different agencies. It is actually a tool that has been contributed to by several partners who I see also represented in the members who are participating in this call. So thank you very much. And this toolkit takes you right through all the different steps of an education sector analysis and plan, and including the evaluation, etc., so that there is a strong support for early childhood education. And let's go straight into 2 of the key tools that look at cost and financing. So next slide, and we can maybe go to the online toolkit itself, and I can take you through some of the key elements of that. So the very first one we are looking at is tool 2.3. This is a list of, so this actually has, let's scroll down to the objectives, please. Okay, so it doesn't matter, we can stay here. So basically this tool is focusing on some of the key indicators that should inform an education sector analysis focusing on early childhood education. And it is also useful as we go beyond to design the plans and then also establish ways of tracking whether we are doing well as the education sector plans are implemented and they are evaluated for the next round of cycle. One of the very cool things about this tool is that it prioritizes the indicators according to the importance within that analysis. And you see here the color codes of red, yellow, and green, where absolute priority indicators are in red and then so forth. And let's scroll down towards the, okay, let's stop there. So you see here that there are these three categories of tools, and if we can just click on the eye of the first one in the red, so this is one of the absolute importance indicator, and you see here that everything from the definition to potential sources of data, and also a little bit of guidance on how this indicator can be populated is provided in the toolkit, and we can close this. And going down further, just keep scrolling down and we can see that a range of indicators are in fact identified. In this box, you also see just a little bit above, yeah. So you also see that, you know, very often we know that in early childhood education, we may not have all the data that we want. So there are also some tools and tips to see where directly data may not be available, how still some of these indicators can be populated for the immediate analysis. And so you have some suggestions out there where data may not be available. Let's go further down to table 2. This is the second set of resources which actually focuses on some of the cost drivers that are that inform education sector planning. And if we scroll down, so again, of course, they are classified, but if you scroll down to the summary, there we are, that one. So here you see the key cost drivers around what you would spend on the workforce, the infrastructure, particularly capital cost, looking at learning materials. There are also elements around social spending and especially related to the other sectoral processes as well. Some of the process costs, particularly when we are looking at system strengthening, and also on the operational inputs. In the interest of time, I won't go into the details of these, but that's how some of the cost drivers could be identified to take us forward. And maybe right at the bottom, there is a tab on Annex. Yes, please. So here you see that there are also other resources that you can see. And this particular Annex, in fact, looks at some of the models and examples which have been used to have used these different indicators and the analyses, so that countries who are embarking new on these processes can learn from that and adapt as they require. Let's go to the next tool, which is 3.3. And this tool is looking at, you know, once you've of course got your basic situation analysis as we described in 2.2, this one is looking more at how simulation models can be developed and then used for advocacy, and also actually prioritizing as countries are seeing what exactly they want to put in their plans to fit the resource envelope and to fit also the key priorities that were identified. And let's go to the tool. So you see that here we have, yes, let's stay on that slide for a bit. So you can see that the tool can be downloaded for working offline, but also is available to work online. In fact, that goes for the whole toolkit. And in fact, many sections of the toolkit are now available in English, French, and Spanish languages. And here you see that the first part of this tool, 3.3, looks at some of the tips on the information that is required for costers and planners. And it is very mindful that when we are doing this costing analysis, there is, of course, the ECE technical experts who are usually involved, but we also need to be able to interlocute and engage meaningfully with the colleagues on the planning and costing side who may not entirely be that familiar with the ECE parameters that we like to factor in. So a healthy interaction and learning from each other is what this tool presupposes and supports. And so you have the kinds of checklist of information that as ECE practitioners and technical experts we need to know of, and similarly what on the planner side what we want to populate. Let's go to the third tab on ECE simulation model examples. So here, here you see there are two examples that are given, one from Sao Tome and Principe, where a need-based projection model has been exemplified of how it was used. This is a real example from the analysis that was undertaken. And the second one is from Lesotho, which had undertaken an intervention-based model when they introduced 1 year of pre-primary ahead of primary, and then that reception class modeling for universalization was costed and used for then further discussion with the different stakeholders. I think to go just to close on the toolkit, just the final one where we are showing the little further down, keep scrolling. Okay, so if you just take the tab back, and meanwhile I'll continue to speak. So there is a tab on showing how the analysis then informs your prioritization. So basically what happens is that once these analyses have been done, then it enables stakeholders to engage with the Ministry of Finance, within the Ministry of Education also, as different subsectors are being used. Exactly, thank you so much. So there would be a somewhat of a back and forth and maybe changing some of the parameters, how we could phase in progressively to reach the final aspirations, but make some choices so that we can have a good roadmap of achieving certain clear milestones with the kind of financing that we want to see supporting the subsector. Let's go back to the slides. So you saw this was just a very, very short taster, and I'm hoping we have already put in the link to the toolkit in the chat box. Do take a moment to browse through and see what is exciting about it. Just to let you know, I won't dwell too much on this in the interest of time, but a number of countries are already using this. We already took the two, Sao Tome and Principe and Lesotho, but also Sierra Leone and South Sudan. South Sudan, particularly in the humanitarian aspect, is using this toolkit as well, as is Somalia, which is not listed here, but indeed we are seeing very, very strongly countries adopting it. In Tajikistan, there is a lot of interest in looking at public-private partnerships to support ECE. And again, the tool is being used to do the analysis that will inform that going forward. Next slide, please. Brief comment on the linkages with the other tools. You've already heard about the global guidance on public financing, and then after me there will be a presentation on the SECT tool. In fact, the ECE Accelerator Toolkit links to both of them. The broad guidance that was given on really positioning ECD altogether within countries, and then this one, the ECE Accelerator specifically looking at the education side of it, and the SECT tool is in fact part of the toolkit, so we make those linkages. Next slide. And finally, of course, we can go to the next slide, please. We do see these as not standalone tools, but in fact as opportunities to connect with each other and use them as a kind of battery that can be helpful for countries. And especially the ECE toolkit is not a linear tool that you have to go definitely from one to the other, but can be dipped in and out of based on the specific needs of the country. I'm going to stop with an invitation to participants on this webinar to definitely please explore the tool, tell us how it is. There is a contact us tab where you can send your comments and suggestions, and we are hoping to strengthen the tool further. So any of you who are actually using it in ESP processes, we'd love to hear from you, and also curate your experiences to enrich the toolkit. I'm going to stop there and hand back to the next speaker, I think, which will be from the Brookings institutions. Thank you very much.
All right, over to Emily and Sarah from the Brookings to take us through the costing tool.
Great, thank you so much. Thanks for everybody for joining us. I see we have people from all over the world: Morocco, Burundi, Mexico, China, Jamaica. It's really great to see all of our colleagues on here. So I will be presenting our work on costing at the Center for Universal Education at the Brookings Institution based in Washington, DC, together with my colleague, Sarah Osborne. Thank you. So why collect cost data? Jenny talked about this a little bit, but it's so important to have cost data and to do cost analysis in order to advocate for investment, also to do budgeting and simulations, for accountability of spending, to be able to do cost effectiveness analyses, as well as to be able to do cost benefit analyses. So cost data is sort of the core component of many other kinds of analysis, and can be used for the purpose of the purposes that I just described. The next slide, please. So why is costing so important, and kind of what are the challenges that we're facing? So we have identified what we see as the barriers to doing costing or cost analysis. On the supply side, we find that there's often insufficient underlying data, and also poor availability or access to tools to collect and to analyze data. And then also there are quite a few methodological complexities when it comes to doing cost exercises. And then on demand side, we see often low prioritization of doing quality cost analysis. Some aversion to transparency can also come into play. And then finally, quite a bit of heterogeneity in terms of capacity and as well as needs. So the next slide, thanks. So we've been doing costing, research on costing ECD since about 2014. We've published a number of reports and studies. The most recent that was published in the Annals of the New York Academy of Sciences around costing and the costing tool that we developed in partnership with the Strategic Impact Evaluation Fund at the World Bank. And I see that Sarah has just put in a link there on a blog, as well as I think our resource page on our work on costing at Brookings. So in the next slide, please. So when we started this research in 2014, we were really thinking about, sort of what are the barriers to achieving quality ECD at scale, ECD and NDCE, and we've heard about some of those today, and one of those was really around sort of, do we know how much it costs, right? So if you're going to a minister of finance and saying you really need to invest in early childhood development, the first question will be, okay, well, how much is it going to cost? And so, so we did a lot of research and really discovered that there was very little data on, what different types of ECD services cost in different contexts. And there seemed to be there were some tools for costing, but there were quite a lot of differences between those tools, and And as a result, the data that came out of those cost analyses really varied quite a bit. So that made it very difficult to really compare across programs, across different types of interventions, et cetera. So at that point, we decided to develop a costing tool, which we named the Standardized ECD Costing Tool, or SECT, which looks like what you're seeing on the screen, which is basically an enormous Excel workbook that has built-in functionalities around, including currency conversions and PPP conversions and amortization, et cetera. And then what that tool does is it sort of spits out on the other end the total cost plus the cost per beneficiary, as well as looking at costs across different cost categories, so that you could really see, what you're spending on across those categories. And the tool was really meant to be used by many different types of actors, and to be able to do both prospective costing, so looking at, if you were to design a program in X setting for a certain number of children, this is what it could cost you, based on estimates, or looking at retrospectively and say, here's a program that's been running for this many years, and how much does that look like? How much is it costing per beneficiary, for example? So in the next slide, we piloted that costing tool in 5 countries in partnership with the World Bank between 2016 and 2017. So in Bangladesh, a parenting education program, micronutrient fortification and early stimulation in Mali, and 3 other programs in other parts of the world. We partnered with both the implementing organizations and as well as the World Bank, but also in some cases, for example, in Mexico, we partnered with the government who was implementing this program. And in that process, and we can go on to the next slide, we really learned a lot. Costing, number one, costing is not an easy process. There are a lot of complexities, as I mentioned, and we really learned that the tool that we had developed, while it was really good, I think, in terms of all of the components, in terms of user friendliness, it was really not reaching its full potential. And so we decided to modify the tool and create an online user-friendly format with an accompanying user guide, and building this on the Tangerine platform. Some of you may be familiar with Tangerine, which was developed by RTI and can be used for different types of assessments. And so the tool is meant to be used across ECD sectors, including integrated programs, but we also expanded it to include primary and secondary education because we really received a lot of demand, and it really was not so much of an extra lift to include those as well. And we thought that would be very helpful. The tool also includes the same kinds of functionalities that the first version had. And then on top of that, we're really, our goal is to build a database on costs, on ECD costs and education costs, because, as I mentioned before, really the data is really quite sparse around that. And as I mentioned before, the tool is meant to be used by policymakers and funders, implementers, researchers, and it's really meant to be user-friendly, much more user-friendly, this version in the online version. And the next slide. So what kinds of questions can this tool be used to answer? So here are just some examples. So, what resources are needed to deliver an intervention? How are these costs distributed across categories for the intervention or program? I saw a question earlier that was related to quality and, how do we ensure that we're not just focused on inputs? I think that's a really excellent question. And with this tool, we really are hoping to really get at kind of what are those aspects of quality. And so those who go through the exercise are really required to kind of go through each of those categories of resource types, and which you'll hear more about from Sarah, but we can talk more about that perhaps in the Q&A. In the next slide. So here I'm going to hand over to Sarah, who will talk a little bit about sort of how the tool can be used and what you can expect moving forward. Thank you.
Great. So as Emily mentioned, the tool is designed to be used across a wide variety of intervention types and sectors that impact ECD and early childhood education. Of course, a full listing of those is on your screen now. I won't read them to you, as you all are certainly in the audience experts on these, but just really wanting to emphasize that the tool is designed to be multi-sectoral and inclusive across intervention types. Next slide, please. Wonderful. So in order to better understand how resources are allocated within a program or a project, the tool, the costing calculator, as we're calling it, broadly has two different categories of costs, which we have dubbed overhead costs and direct implementation costs. So within overhead costs, that's going to include things like program design, indirect program management, so the home office management type functions, the program evaluation costs, and other overhead costs that don't fit into those previous three categories. Direct implementation costs will include things like training, direct delivery or instruction, direct program management costs, and transfers to individuals or families, such as in the form of cash or scholarships or food. And of course, anything that doesn't fit into those categories. However, as most people who work in program management or finance or in these areas realize, of course, these categories are subjective. They have different definitions across different organizations, as well as kind of different accounting guidelines within organizations, and the boundaries between these different categories can be quite blurred. So accompanying the cost calculator tool will be an extensive guidance document that includes definitions of each of these different cost categories, what is and isn't included, examples, etc. Next slide, please. Wonderful. And so in addition to the cost categories that I mentioned, there are also 6 different resource types that the cost calculator include, which are labor, personnel, equipment, materials and supplies, travel related costs, facilities related costs, and then other. Same disclaimer to the previous slide, recognizing that the definition of these terms varies widely and isn't universally agreed upon. The guidance documents will also include some extensive definitions and context for these different resource types. Great. And then in addition to being classified by cost category and resource type, each cost or resource entered in the tool will also be kind of tagged with whether it's an investment or a recurrent cost, so a one-time upfront cost or an ongoing cost, as well as an imputed or donated cost versus something that's paid for directly by the program. And all of these different cost tags are intended to be able to allow the user to explore their data across a wide variety of different costs. If they want to just see certain intervention costs, just see certain donated resources or costs. And so a lot of different kind of sorting and visualization functionalities. Next slide, please. Great, and so the cost calculator, its associated guidance resources that I've mentioned, as well as these costing case studies, this database that Emily referred to, will all be housed on a standalone public website. The website is currently under construction. We're really excited to share it in the coming months. So these images that you see on the screen are just illustrative at this point. But one point I do want to mention about those case studies and that database to answer a question that's come up in the chat. In addition to being able to tag the individual kind of resources or pieces of the program, there's also kind of macro level program tags, including children with disabilities and other marginalized refugee communities, girls, specific population targeting kind of program tags that will allow this database to be more applicable and searchable by context. Next slide, please. And so as Emily mentioned, the cost calculator is being developed in the Tangerine platform. And so Tangerine is essentially a survey-based platform. And so there's a series of questions and skip logics built in for different scenarios or different kind of contexts of the specific item that you're entering into the costing tool. And it is structured such that each category that I mentioned in my first slide is a separate form, as you see on the left-hand image. And also that there's a lot of built-in functionalities like kind of checks and summary boxes that you see in the right hand to try to make this a user-friendly and accessible tool, being able to see both the big picture and the small. Next slide, please. And there's also going to be some kind of automatic data visualizations at the end of the exercise that you're able to see the different breakdown of your costs by those different tags that I was mentioning, the cost categories and the resource types. And so again, these images are just illustrative, but these will be available within the Tangerine platform to be able to explore your own data, as well as some curated examples with the permission of those who are doing the exercise, of course, will be available in the database that's housed on the website. Wonderful. And what's next? So this slide, once a beta version is available, so in a slight correction, an exciting correction to this, our beta version is actually currently complete and is just undergoing some final user testing for bugs. And we're going to be starting to pilot in the coming months. And so we're aiming to have pilots representation from a wide range of geographies, intervention types, and organization types. And so if your organization is interested in piloting the tool, we would love to hear from you. And I'll share a link in the chat in just a minute about how to brief survey of interest that you can fill out, and we'll get in touch from there. And following the piloting phase, the tool will be free and publicly available for anyone who is interested in using it. And of course, please, on the next slide, feel free to be in touch with us directly if you have any questions about the tool, and we are really excited to share it with you all. So with that, I will pass the baton back to Shikufe.
Thank you so much, Sarah and Emily. All right, and now to our last speaker, Claudia Vasquez, who will be speaking on behalf of ICTAN. Over to you, Claudia.
Thank you. Hello, everyone. I'm going to present a tool for the estimation of what we call the cost of inaction. Next slide, please. The cost of inaction is the net benefit foregone in a society for not invested in recommended interventions. The methodology is based on ex-ante economic evaluations, where potential future benefits are discounted to the present and compared to cost to estimate the net present value. So that's the idea behind the cost of inaction, is what societies forgone by not investing in children. Next slide, please. Well, here is like our conceptual framework where you can see the different risks that children are exposed to, and those risks can be mitigated through private and public investments. Different studies have shown the positive impacts that those investments has both in the short and in the long term. These investments impact different outcomes at different moments in the life circle. So to monetize the benefits of a specific intervention, we focus on the long-term impact on the adult productivity, labor productivity, so we can consider that benefit for the estimation of the cost of inaction. Next slide, please. The tool for estimating the cost of inaction is online. It's very important that this tool is interactive because it allows the user to customize all the parameters involved in the simulation. For example, the parameters that are related to the intervention cost or the intervention population targets. So the user can set the value of all the parameters and get the estimates of the cost of inaction as a result. The tool is very flexible because it can evaluate interventions in different sectors and covers more than 180 countries. We think that this tool is very useful specifically for policymakers and also for funding agencies because it allows to compare interventions in terms of the economic return that each intervention has for the whole society. And now the tool is being tested in 3 developing countries with specific interventions that are being evaluated with the concept of the cost of inaction. Next slide, please. Well, this is the tool. We think that is very friendly for different users. The fields that has to be completed by the user are at the bottom of the page. For example, the user have to select the discount rate that is going to be used for discounting the future benefits. And also other assumptions, for example, the age children will enter the labor market that may be specific to the context that where the tool is being implemented. And well, other parameters also need to be completed. And then at the right hand of the screen, you can see the main results that the tool generates. For example, the first one is the cost of inaction in dollars. The second one is the cost of inaction as a share of the GDP of the specific country. And the last one is the benefit to cost ratio. So I think those 3 are very important outcomes to discuss the economic returns that different interventions has and compare and decide on which programs to expand, for example. Next, please. Here, the figure is an example of the estimated cost of inaction as a share of the GDP of not reaching universal coverage in preschool for 4 countries. And we in this figure, we can see that the simulation considers different discount rates and different numbers of years in the labor markets. So as you can see, the results are sensible to these assumptions. So it is very important that the user is in control of these values. So the tool allows the user to define all these parameters that then have an impact on the results. So for example, when the user decides to use a lower discount rate, the cost of inaction is higher. And the same thing happens when the number of years that are considered to capture benefits. When you consider more years in the labor market, the cost of inaction also is higher. Next, please. And the last slide is to show that this same methodology that was developed for the cost of inaction, it can also be used to estimate, for example, the economic impact that COVID has in terms of the preschool program closures. We know that programs were closed in many countries, so we estimated for 140 countries, and we found that the median loss for a 12-month cut in the participation of children in the preschool programs was about 3.4% of the GDP for low-income economies. So this tool is also very, the methodology can be used to ask different research questions, but was developed mainly to estimate what we call the cost of inaction. I think this is the last slide.
Wonderful. Maya, if you could just stop the sharing so we can see and inviting all the panelists to come on. Over to you, Melissa.
Thank you so much. So we really want to hear from you, and you've had so many great questions in the Q&A. So we're going to keep our panel discussion short so that we can get to some of the questions. And you might see that we're only going to ask a few questions to the panelists to expand a little bit more. And one or two of these questions may cover some of your questions in the Q&A. So first, I'd like to ask both Jenny and Anna from Unicef and Emily of when is your tool particularly useful? Who can use it? And what would be the starting point to use your tool? So I'll start with either Jenny or Anna to answer, and then invite Emily to answer the same question. Thanks.
Thank you, Melissa. And I'll start that question with the second part in terms of who can use it, because the resource guide was specifically designed to be useful to all ECD practitioners, regardless of their background. And this was with the goal of helping people who have a specific knowledge of ECD goals and policies and programs, and how to help these people understand and engage with the process of financing these services. Because if we don't think about the financing, we don't successfully translate our goals into the budget. We don't actually translate these policies into programs and services on the ground. And the main principle is really working with different stakeholders, such as, for example, the Ministry of Finance. And when you focus on these stakeholders, it helps to identify what information and data you need to move these processes forward. So as Anna mentioned, understanding the budget timetable, the type of data and information used by a Ministry of Finance to prioritize budget proposals. And you're recognizing that a Ministry of Finance has specific priorities and needs, and so may be more interested in return of investment information, or the cost efficiency and accountability of programs, or the economic opportunity of childcare models that allow parents to return to work. So being able to plan your engagement in financing based on the needs of these stakeholders will then help you select the right tool, and will help you frame your work accordingly. And for the second part, in terms of when it's useful, we hope it is useful at any stage. So obviously for people who are just getting started to think about these issues, but also if you already have a body of research and analysis and are looking at how to translate this into advocacy, or if you're encountering particular challenges and you want to see how other countries have focused on these issues and different approaches from different contexts.
Thank you. Emily?
Yeah, great. I'll jump in. I think my answer is actually very much the same. We really, the cost calculator is really meant to be used by a variety of types of actors, policymakers and implementers. So perhaps those who are doing the financial management in a project, doing the budgeting and planning. I think that the calculator is really actually a good sort of common ground that can be used to connect across multiple actors, so that there's standardized way for looking at the costs. And in terms of sort of how and when can it be used, as I mentioned, it can be used both retrospectively or prospectively in terms of program design, looking at what resources are needed, what would be the cost of scaling up a program or intervention, and how these costs are distributed across categories. What are the cost implications of a programmatic change, such as in terms of dosage. So I think that answers those two questions. And as I mentioned, we're entering into, and Sarah mentioned, we're entering into this pilot phase. We're seeking pilot partners across the globe from a variety of types of institutions, different types of actors, as well as different types of interventions. Sarah put the link in the chat there, where you can, if you're interested, fill in an expression of interest survey. and then we can see your interest. And as I said, that we aren't able in this first piloting phase to select everyone who wants to be engaged, because we're trying to get a spread in terms of geography and types of interventions and types of actors, because we really want to test out the cost calculator to see how it's working in terms of its user friendliness and accessibility, et cetera. So we look forward to hearing from those of you who are interested, and happy to answer any further questions about the cost calculator. Thanks.
Thank you both. So some really great tips about how we can use these tools in planning, monitoring, evaluation, and really this data for decision making, which is so important in our work. So for our second question, I think this touches on some of the questions we saw in the Q&A that Anna has answered on equity, that Sarah covered in the presentation, and may touch on Sarah Klaus's question as well as Julia's question on the EC accelerator. So what specific context are these tools relevant for? Do they take in consideration humanitarian populations, vulnerable families, or other groups? And so I'll first ask Divya, and then we'll invite Claudia to answer the same question. Thank you.
Thank you. Thank you very much for that question. So when we look at the ECE accelerator tool and actually link it up to the public financing discussion, so it actually addresses those three core actions to address financing bottlenecks: the budget advocacy, supporting budget processes, and promoting budget coordination within the education section. So anybody who wants to work with the government to mainstream ECE within the education sector, especially through ESP processes, I think that's the main target audience. And usually these processes are, of course, initiated through key agencies, including Unicef, who work very closely with the government, but are also draw upon very specifically from stakeholders who are involved in the sector and subsector. Let me also very quickly add, many agencies have actually come back to us to also say they want to use it for strengthening their own teams and their own analysis of what their strategic focus should be. So in that sense, also agencies are using it. On the issue of the different, priority groups or rather underserved groups that this tool responds to, the overall education sector analysis does look at issues of gender, children with disabilities, and also humanitarian situations. At the moment, we have included, and you can use the search tab on the online tool to access some of these resources. Not all tools are fully comprehensive at this stage, and that is where it is still a live tool growing every day with all the resources we get referred to. But let me also say very quickly, on the humanitarian side, we are in fact planning a specific webinar maybe towards the end of September or sometime in September. So watch out the space. We will let you know, to specifically see how this can be used for humanitarian settings and really making sure that both within the education sector planning and also on the humanitarian sector side, the key stakeholders there, how the issues of ECE can be understood, and particularly the system strengthening and especially cost and financing can be factored in those plans. I hope I've covered all aspects. Let me stop there. Thank you.
Thank you, Divya. Claudia?
Sorry, I was mute. Can you repeat the question, please?
Oh, now I was muted. Sure. So the question is, what specific context would the cost of inaction tool be relevant for? Does it take into consideration humanitarian populations, vulnerable families, or other groups? Thank you.
Thank you. Yes, I think that the tool is particularly important in countries that do not have these programs, for example, ACD programs at scale, that only some very few, very low share of the children can access to the program, so they need to be expanded. So in that context, I think that is particularly important because it's what the cost of inaction try to measure, what we are not doing. The countries where these ACD programs are very expanded and access is very high, it's not that relevant for those countries to use the cost of inaction because they already have the programs in place. And so I think that the tool is particularly useful for developing countries and for countries that do not have the access that is needed for the children, for the development. So I think that is particularly important in the intervention. For example, some countries have made progress in preschool access, but they do not have intervention for younger children. So in that case, I think the tool is very important.
Melissa, can I jump in on this one too?
Sure, go ahead.
Thanks. So I think that's sort of one of the key questions here, and it's come up in several of the questions, is around quality and is around tailoring services to the beneficiaries, to the individual children, right? And so, you know, that may mean there are many different ways that can show up in terms of, you know, where the child is living, what particular needs they have, et cetera. And I think that, you know, I don't think that any of these tools sort of have them or like the magic bullet to ensure that, you know, or that sort of have like built in to some extent, like the answer to that question. But I think that what these tools can do, and I'll speak specifically to the calculator, is really highlight what are the resource types that should be considered, and you know, and to that needs to be brought the information of, you know, what does a particular marginalized child need in terms of the dosage, in terms of the teacher pupil ratio, in terms of other types of resources, you know, may they be materials or, you know, or other types of infrastructure, et cetera. So I just want to just highlight that it's our job for all of us to sort of to bring that information, to bring the data, the evidence that we know around that quality and around the attention to, you know, to the particular needs of the individuals, to these cost and financing exercises.
Thanks, Emily, for adding that point. And as you can see in the chat, we've posted all of the tools or links, yeah, to those sites. So please take a look for more. I want to make sure that we have time to get to some of your questions. So I'm going to pass it over to Shakofe to take us through your Q&A. Thank you.
Thanks so much, Melissa. We've had some really great questions come in the Q&A, and while some have been answered, I think it's worthwhile, you know, answering them live as well. So I have about I have 5 people who have been allowed to speak, and I'll call on you if you can please just introduce yourself, where you're calling from, and keep your questions quite brief and succinct, and we'll have the panelists respond to them. All right, we're going to begin with Hessa Al-Suwaidi. If you can just unmute yourself and briefly ask your question.
Thank you. I'm Hessa from Sharjah Child Friendly Office, the United Arab Emirates. My question was about, again, in the universal access to early childhood education. In our country, and I think in, let's say, most countries, there is a structured programs, but the access is not widely available for all children in the country. With COVID-19, there was online education, early education, and it was very successful here in our country. So I was wondering if there is any other programs. Of course, we saw today a very successful also interventions that can, let's say, provide access to all children, especially for less fortunate families who cannot afford to go to private sector. Thank you.
All right, over to you, panelists. Who would like to respond to Hessa? Thank you, Hessa.
Maybe I can jump in on the education side. And sorry, my internet was, so I did miss part of the question, but I think the main thing is for families and children who are not able to access what may be the possibility. So for the ECE Accelerator Toolkit, this is actually the most important issue as we start looking at the situation analysis. And the toolkit allows stakeholders who are engaged in the process to look at data which informs where is it that the gaps in access are, and also looking at different components of the program, different kinds of approaches that can be used to then reach out innovatively to more vulnerable populations or those who are usually underserved. They often have, of course, particular cost indications on that. So when you're doing the cost analysis, those issues are again populated through this database. The main point is that the toolkit allows stakeholders to contextually define who are the underserved, what kind of priorities may be possible, and then through the simulation processes on cost to be able to say what may be the more doable way forward immediately, and then progressively moving forward as the system matures. Thank you.
Vivian. Anna, you have your hand raised if you want to share a brief response.
Yeah, very quickly, I wanted to also add to that response that I think that this is a key point, that a lot of people see COVID obviously as something that has posed a lot of challenges, but I always try to also look at the positive side of it, which is difficult, I know, in these times to do. But one of the things that I have really seen that many countries are experiencing is a new space to have that dialogue, or what are those key services that we need to provide to vulnerable population, and how can we do that? How can we reimagine those services, and how can we be more cost efficient? So I think that one of the things that has come in the chat is how do we convince the government, knowing that the budget is a political process, we're fighting for space. One of the key arguments sometimes is not to go from the beginning and ask for more money, but actually first help them understand how much are you spending already? What are you getting from that investment? What are the outcomes? And I love that question that came in the chat about the quality of what you're getting, what you're paying for, what is that translated into? And once you have that baseline understanding, then moving into how can we deliver these services in a more cost-efficient way. Efficiency gains, that argument really resonates with policymakers because we know that we have a very limited fiscal space. So I just wanted to very briefly share with Hessa the example that we had in Serbia, where we were actually very quickly able to translate a lot of the home visits that we were providing face-to-face into telehealth. So we were able to train very quickly our home visiting nurses and make sure that they were able to provide that service in a more consistent way and a more cost-efficient way. So now what is happening is that now that the crisis is actually being somehow resolved in Serbia, the government is trying to keep that telehealth service going and has asked Unicef to help us cost what it would take to actually deliver telehealth in a blended approach, where the families that need more support would actually get telehealth and also face-to-face, but how can we use the telehealth to be universal? So just trying to say that there are opportunities of rethinking cost efficiency delivery of services. Over to you, Chico.
Thank you. And I think that's a really good segue to the comment that Craig had about fiscal space. So Craig, over to you if you can be brief in your remarks.
Okay, hi, thanks for that. Craig Furler, Country Director for Children in Crossfire in Tanzania. It was more of a comment, and it's more of me just struggling in my own mind, thinking of engaging with the Ministry of Finance and planning departments on really, I'm really making a case for huge investments in the early years within a context where the fiscal space is obviously even more limited now. So this webinar is really giving a strong position on how to effectively cost. So let's assume we've got all of the, a really strong basis on what are the costs, including thinking of efficiency gains, etc., which we can sort of optimize in ECD and early learning investments. But it would really help to have even more evidence packaged, which is accessible to implementers such as ourselves, to be able to engage with ministries of finance and really make the case for, is it taking away or reallocating from other sectors? Or is it about looking with the medium term and trying to make sure that as the fiscal space increases, we've got almost ring-fence commitments to allocate some of that increase to the earliest years? Because the final point I had in a comment was, for instance, the Unicef ESARO Heckman report, quantifying Heckman report recently, fascinatingly showed that the main spend was at the wrong end of the curve, as it were, in secondary education, higher education, etc. But of course, we don't want to take away from that. Indeed, the spend is still low in those areas. So it's more about protecting those areas of spend and finding more fiscal space, which would be prioritized for the earliest years.
Craig, I'm sorry to interrupt, but we only have a few minutes.
Yeah, I'm sorry. I found it a complicated comment, but it's part of the challenge I have thinking with the finances. So let me leave it there.
Thank you so much. All right, a brief comment from a panelist.
I had started typing a response to you, Craig, but it ended up being a bit of an essay, and I hadn't posted it because this is a really critical area. A lot of work is being done specifically on this issue about investing in social spending and the return on investment in human capital, and how we package and promote that, specifically given the opportunity that COVID has created and the importance of these principles of social support and equity and an inclusive recovery. And some of the information that we've seen in how different countries have responded with better social support versus countries that didn't have those systems and mechanisms. So at a global level, a lot of work is being done in this space. And when we're looking at some of the financing for development forums, etc., hopefully you'll start to see some ways of packaging the information in that context. It's definitely challenging given governments are very familiar with the return on investment of infrastructure. How do we actually support and promote investment in social services, recognizing that there is an expense, but there is also a critical opportunity to not just support individuals, but grow your country and grow your economy from these early stage investments. And just secondly, very quickly on the Heckman analysis, I completely agree. And it's one issue with how we present this type of data, that just because we show that younger children are receiving less benefit than older children does not mean the easy option is just to give less to older children. So that's why these kind of higher level analyses, you really have to then take them down to the country level and follow that up with the more detailed analysis, having shown that younger children are not benefiting, to then go through the budget and look at what are the priorities and what is a cost-effective way of meeting those priorities. And that should look at the whole budget, not just reallocating within the very small spending that we have in, for example, health, education, or other forms of social spending. And I could talk about this a lot longer, but I will apologies and pass back.
Melissa, you have your hand up.
Sure, I just wanted to say quickly that at the World Bank, we are finalizing a volume on quality early learning that'll be published later this year, and I think could complement a lot of these tools on costing. What the volume will it's focused on lower and middle income countries and thinking specifically on quality early childhood education and how do we get there. And I think hopefully, we're working on how do you kind of diagnose on each of these level of quality, thinking that most education systems, the majority of resources go towards infrastructure and teacher salaries and training. So that'll be coming soon, and I think that'll will, as I said, really complement some of this costing work to think about how do you make decisions, how do you prioritize to, as Anna said, gain efficiencies while hopefully we're also scaling up funding in the future. Thank you.
Great. And with that, we are out of time. Many apologies to June, Sarah, and Fernando. We couldn't get your questions, but they have been answered in the Q&A. So hopefully you can take a moment to read the responses. And I'll now turn it over to Elizabeth Goulet, the Executive Director of ECTAN, for some closing remarks.
Well, first of all, this has been a very rich discussion, and many thanks to the excellent presentations made by the panelists. But I just wanted to say that this work also demonstrates the power of partnerships in action. These tools were developed and they're complementary. They were developed through a consultative process with so many others and working together with governments as well. They help us as entry points to address many of the issues, including equity and inclusion. They help us to begin to understand how to speak the same language as ministers of finance and make the case. They help us build an investment case, especially now with COVID-19. The need to make the case in investing in younger children has never been greater. It's not taking away, but it's making sure that governments understand the cost of inaction, but also the fact that investing in young children is building the human capital that we need in the future. I would like to invite all of you that are working on other tools to share them with us, to align with us, to help us pilot them in different countries. We can build it together for young children. So many thanks to the participants who have joined us and are still with us. This work is indeed a work in progress. And I'd like to say special thanks actually to OSF, and I see Sarah Klaus is online as well for supporting the development of some of these tools. So thanks everybody, and I wish you a good day and the rest of the week. Thank you.
As we're leaving, Sarah, I don't know, maybe you might want to just come on and say a couple of words. It would be great to hear from you. Okay, well, that's the end of our webinar. Sarah, if you're still around, it'd be great to hear from you. If not, thanks everyone, and we will share the recordings, the presentations, and everything with you as always. Have a wonderful day.
Thank you.